Good afternoon and welcome to the latest installment of the Alliance's COVID-19 webinar series. I'm Nan Roman, President of the National Alliance to End Homelessness. I'll be your host on today's webinar, and I'll also be making a presentation on the framework for the COVID-19 homelessness response. I want to highlight today a resource before we get started that the Alliance has recently launched via our brand new Center for Learning, which is an online learning platform. That resource was developed in partnership with the National Healthcare for the Homeless Council, the COVID-19 Learning Series. This is an online learning series developed to help you onboard staff, homeless service providers, community health workers, and others who are supporting people experiencing homelessness while staying in hotels and motels and other non-congregate settings as a result of the coronavirus. This is a full curriculum with 7 courses on issues including harm reduction, trauma-informed care, cultural humility, case management in the COVID-19 era, and others. You can sign up by going to endhomelessness.org/COVID-learning. And if you haven't already, please sign up for the Ending Homelessness Forum at forum.endhomelessness.org. This forum is a place where you can create communities of learning, share or look for solutions to specific challenges, and generally work together to solve problems. Now to get on with the webinar, again, I'm Nan Roman from the Alliance. I'll be talking you through the framework for a COVID-19 homelessness response. Then joining us to discuss what they have done in their states are Richard Cho, Executive Director of the Connecticut Coalition to End Homelessness, and Nichelle Carver, Associate Director for Homelessness and Special Needs Housing at the Virginia Department of Housing and Community Development. So I will begin. As you know, jurisdictions are receiving a significant amount of money to address homelessness via the CARES Act. In particular, there's a $4 billion fund for ESG, Emergency Solutions Grants. That is versus $270 million in the last appropriation, so it's nearly 15 times as much as you normally get. And there's other money through the CARES Act in the Community Development Block Grant Program and the Coronavirus Relief Funding, not to mention FEMA funds. And more resources could very well come in the next stimulus bill as well, if we all do our jobs. It is critical to use this influx of money wisely and strategically, obviously. It's not a business as usual situation, or a matter of just spending the money as quickly as possible. Homelessness could grow or shrink depending on the approach you take to using these resources. We need to use the money primarily to address the public health and economic recovery issues at hand, but we also need to use it in a way that will prevent a rise in homelessness and restructure homelessness approaches so that we're better off moving forward. And we need to use it to improve equity and equality. So there's a lot for us to think about. To help you think about how to use these resources, the Alliance, along with the National Healthcare for the Homeless Council, the Center on Budget and Policy Priorities, and the National Low-Income Housing Coalition, have put together a framework for the COVID-19 homelessness response. This is a general guide of things that communities should be thinking about in terms of how you allocate your resources and the approaches you take. Before we get to the framework, there are a few key overlying values that I want to discuss. I think we need to go back. Yeah, thank you. First, there is a commitment to address racial and income disparities. It's critical to note that both homelessness and the pandemic shine a light on racial and economic inequality in the nation. Both disproportionately affect African Americans and some other racial minorities and very low-income people. We need to use the funds in ways that help eliminate disparities, not exacerbate them. This is a critical overlay to the framework. Key ways the framework suggests to do this are involving people with lived experience, people of color, and extremely low-income people in planning and implementation, collecting data on what you're doing, making sure you have the ability to look at your performance on the basis of race and income equity, analyzing your data for disparities in services and outcomes, and then remediating any disparities that you find. Another important value of the framework is the imperative to help people with the highest needs first. People who are unsheltered, older, medically vulnerable, disabled, ill, and literally homeless should be helped before people with less serious barriers and problems. Only when all of them are helped should resources be turned to those who are slightly better off and to prevention. And in this context, I'm talking about the homelessness resources only. Obviously, other people do need assistance. It's about who we help with the homelessness resources. The point is not just to spend the money quickly, but to spend the money wisely. And helping the most vulnerable first will help us to achieve that. Another important priority of the framework is to get people into housing. Getting people off the street and into the appropriate shelter is not the goal. We need to take this opportunity of the stimulus resources to get people into housing. That's the best protection for their health, and that is the best way to ensure a solid economic recovery. We certainly do not want to move people into hotels and motels only to send them back to the streets or congregate shelter. We must use this opportunity and these resources to get people into housing quickly. Succeeding is likely to mean that you've created meaningful partnerships with non-homeless sectors, especially housing, healthcare, and employment. And particularly important in their relevant realms are public health departments and public housing authorities. Also essential in many communities are police and fire departments or other emergency services departments. Many aspects of the homelessness work will be better carried out and are financed by your partners and not with the homelessness resources. Prevention is particularly important to think about in that context. Most so-called homelessness prevention is actually eviction prevention, and it does not necessarily prevent people from becoming homeless. Relatively few poor and low-income households with an eviction notice actually become homeless right away. That's not to say that eviction prevention is not important. Eviction prevention is really important, but it should not largely be financed using homelessness funding. And finally, we must act quickly in the context of the pandemic. Business as usual is not going to work. We must remove all barriers and act with alacrity to move people indoors, to attend to their health, protect them, and get them into homes with jobs and health care, and to prevent a new wave of homelessness post-pandemic. And this all has to happen in weeks, not years. New slide, please. Next slide. The purpose of the framework is to provide some guidance on where to focus your community's efforts and in what order as you are thinking through these new resources. The framework lays out 5 key things that policymakers at the local level should think about. They are people who are unsheltered, shelters, housing, diversion and prevention, and improving our approach. All 5 things need to be addressed, and if you can do them all at full bore, that would be great, but likely you are going to have to set priorities, and those priorities should be addressing the public health and recovery crises and helping the highest need people first. The framework also indicates the order in which things can be addressed. I'm not going to go into that here, but you can see it on the framework. So quickly running through the activities. Next slide, please. The first key area of focus is on people who are unsheltered. Living outside or in places not meant for human habitation is certainly not acceptable in the context of the pandemic. Unsheltered people cannot undertake preventive measures such as hand washing or reliably maintain hygiene. They typically live in unhealthy environments, and their baseline health is much worse than that of sheltered people. They're extremely vulnerable to the disease. The lack of testing among homeless people has prevented us from having certainty about the risk of infection among different groups of homeless people. But although being outside has its benefits, it would certainly be preferable to move unsheltered people into private rooms or health facilities if that is needed. Many unsheltered people will likely refuse to come in. In their experience, they have to give up a lot to get space in a shelter, and they often don't get much in return. This is often because shelters are high barrier, have a lot of rules, and do not provide any significant pathway to housing. Alternatives like low barrier, housing focused shelter that are acceptable to them will have to be found. Next slide, please. The second key area of focus is shelter. Congregate shelter is not a good place for people in general. It's stressful, often traumatic and unsafe, and clearly not a good public health strategy. An immediate priority is to reconfigure shelter space according to CDC guidelines for social distancing, quarantine, isolation, and medical care. All shelters should be low barrier, accept pets, possessions, and partners, and be housing focused. A longer-term priority is to eliminate congregate shelter altogether in favor of shelter with private rooms and bathrooms, and to shorten length of stay in shelter by moving people more quickly into housing. Next slide, please. The third key area of focus is housing. This recommends that you stay the course on whatever you are currently doing and that you check with existing rapid rehousing tenants to see if they need additional months of rental subsidy, and that you also check with your existing permanent supportive housing tenants to make sure that they are getting adequate services. Moving forward, you can be planning to move all people who are in private rooms to housing, including permanent supportive housing, and eventually to move all people experiencing homelessness to housing. This, of course, will require getting much more creative about housing models because of the shortage of units available, to include shared housing, repurposed housing, purchasing housing, shallow subsidies. We need more subsidies too, of course. Like having an SSI program with a shallow subsidy attached, helping people return to families if that's a productive step for them. We're obviously, as I said, going to need to get a lot more resources to pay for this housing. We are working on that in the next stimulus bill, and we'll need your help to get that too. Next slide, please. The fourth key area is diversion and prevention. Diversion for people who have become homeless but have not yet entered shelter or gone to the street can reduce the number that becomes homeless significantly. It makes sense to go to scale on diversion quickly. This often requires flexible funds. Prevention, as I mentioned, generally should not be funded using homelessness resources because we don't currently really know how to target prevention very well. So it's unlikely to prevent very much homelessness. It will help people, but it won't prevent homelessness. And it generally ends up being more eviction prevention than homelessness prevention. If you help everyone who is homeless and end up having resources to do prevention, we would suggest that you start that prevention effort with the very lowest income people who are at the very highest risk of homelessness, such as people with disabilities, transgender people, and so forth. And that you also really target people who have previous experiences of homelessness. Next slide, please. And finally, we could come out of all of this in a better situation by improving our systems for the future. We could establish strong partnerships between continuums of care, public housing authorities, public health departments, and employment systems. We could establish equity-based decision-making. We could realize we can stand up shelter a lot faster than we thought we could, eliminate congregate shelter. We could realize that we can house people then a lot faster than we thought that we could. And we could end up stopping a new tranche of people without jobs or homes from becoming homeless. And we could create a more just society by ensuring that everyone, no matter their race, ethnicity, gender identity, age, disability status, or LGBTQ status, receives equal treatment because we paid attention and we did things more and differently to help people avoid and escape homelessness. Next slide, please. So that is our framework. We will be updating it every few weeks as things change. You can find it on the Alliance website and homelessness.org. The Alliance and our partners in this framework process are talking to the industry groups that represent entities that will receive the ESG and other funds to share the framework with them and their members. We will be adding shortly an appendix, a sort of appendix that will have tools and protocols and plans that other cities and jurisdictions and TA providers have been creating and have been willing to share with us. So that is the end of the presentation on the framework for COVID response. And I'd now like to turn the webinar over to Richard Cho from Connecticut. Thank you.
Thank you, Nan, and thanks to the Alliance for putting this webinar together and also for the framework that was put together. In retrospect, wish that we had had this framework prior to our state's response to the COVID pandemic's impact on our homeless system, but it's great to have this going forward and to be able to look ahead to what is to come. I'll just share, I'm Richard Cho, CEO of the Connecticut Coalition to End Homelessness. We're a statewide organization that both represents the homeless service sector as well as our private and public sector partners that are all working together to collectively end homelessness. And prior to the COVID pandemic, our role has been to really lead our statewide response to homelessness with a focus on trying to increase the number of people that are both housed who are currently experiencing homelessness, as well as to divert those that were newly falling into homelessness. Prior to the pandemic, we had seen steady reductions in our homeless service system. Connecticut has experienced a 32% decline in homelessness since 2007. Really, I think through the application of the Housing First approach and using a variety of tools, rapid rehousing, supportive housing, other forms of rental assistance, coupled with shelter diversion to try to keep the number of people experiencing homelessness low. And we've been making steady progress. In addition, we had been making and preparing for a major push to end youth homelessness through our Youth Homelessness Demonstration Program funds from HUD. Our state has received about $11 million in YHDP funds. In addition, we had received a grant from Amazon CEO Jeff Bezos through the Day One Families Fund to make a major push to end homelessness among families with children. I can recall back in early March, we had been making steady progress around our efforts, and then on March 7th, heard about the first case of COVID arriving to our state, which we knew was only a matter of time. And at that point, we quickly mobilized to provide as much information as we could, putting together guidance that we received from CDC, as well as whatever available information that we knew about COVID to help inform and prepare our homeless services providers, our shelters, our soup kitchens, our housing providers in our state to be able to prevent COVID outbreaks, knowing that the dangers that this virus posed to people living in congregate settings, given the high level of contagiousness. So in those, during that first month or so of our response, we primarily provided a lot of guidance to our shelters around how to prevent outbreaks through cleaning and disinfection, by maximizing social distancing. And at that point, our State Department of Housing had worked to try to move some of the higher risk folks out of shelters into hotels. So people who were elderly, those who had underlying conditions, those who were immunocompromised, and to place them into hotels. By mid to late March, we realized that just our efforts to implement those basic infectious disease controls would not be adequate, and that we needed to make a much more aggressive response. We were seeing the number of COVID cases in our state in general rising with New York City being a hotspot in our state neighboring New York City, we saw those cases begin to come in up through our northward to our state and realized that we need to take a much more aggressive response. We convinced our state to actually help us to decompress our shelters, to move as many people out of congregate settings as possible and into hotels. And to our state's credit, they immediately responded. They were able to issue an executive order and obtain FEMA approval for non-congregate sheltering. And we worked with our shelters and our regional partners across our state to move 50% of our homeless sheltered population into hotels. And we've since had about 2 months of an extension of that. So currently that non-congregate sheltering order is extended through July 1st. And so really April through June, we've been, and now July, through the beginning of July, we'll be continuing to try to keep people spread out in both our existing shelters as well as in hotels. And now we are currently mounting efforts to figure out what happens next. So beginning this month, we've begun working to try to figure out how do we keep our overall shelter census low, and so that as the hoteling ends, we're not moving 1,000 people back into congregate shelters to be with the other 1,000 people who are currently there, but rather how do we keep our shelter census low? Partners across our state have set a goal to try to house as many people as possible out of shelters and hotels into permanent housing using a variety of different tools. And we've set a goal to try to house roughly 1,000 people in households in the next 120 days, while also working to try to divert many more households so we can keep our shelter census low. At the same time, our state has stepped up with providing more universal systematic testing for COVID within our hotels and our shelters, so that we can actually implement rapid isolation and cohorting of our population. So even as we try to operate shelters, congregate shelters at a lower census than previously, we can also ensure that we prevent any future outbreaks by rapidly intervening in cases where COVID, people are found to be COVID positive. So we're using all of the available federal resources that have come through. Our state is using FEMA reimbursement to cover which provides 75% reimbursement associated with our non-congregate sheltering in hotels. The state is covering the other 25% through the coronavirus relief funds that came as part of the CARES Act. In addition, they're using their emergency solutions grant dollars that they received through the CARES Act to really scale up rapid rehousing and housing navigation supports to assist with our goal to try to house 1,000 people out of hotels and shelters. And meanwhile, we're also tapping into potential private and other sources to be able to scale up additional flexible funding that can be used for shelter diversion and assistance. We also know our state has had an eviction moratorium, and we know that over the last couple of months, there have been fewer people facing evictions, but that when that order is ended, when our courts open up again and begin to review eviction filings, we may begin to see an uptick in more evictions, as well as folks who are not able to access shelter, who are falling into housing crisis. And so even more important at this stage is to think about how we might anticipate those future needs. We're trying to be careful to make sure that we're using our ESG dollars and prioritizing those for people who are currently homeless, as well as those that are on the verge of homelessness, those that can be diverted, and then looking to other sources, whether that's CDBG or other sources, to be able to assist with households that are facing eviction or challenges with paying rent, but who are not on the verge of homelessness. So I think the framework that the Alliance and other partners have put together is really useful in helping to think about how to plan for those needs. There are so many different housing needs at this stage, and ensuring that we're applying both federal and state dollars in smart ways so that we can make sure that we're covering all of our bases. I'll also share that in the midst of this pandemic, our state was concerned about people who are being discharged from prisons, who are hitting their end of sentence and would otherwise fall into homelessness. And with shelters taking fewer new admissions, many of the people leaving prisons who had no housing post-incarceration would end up on the streets. So imagine coming out of a congregate prison setting where COVID cases may be high, and then being released to the streets where they could pose a risk to the larger community. So our state was able to find a small amount of funds through justice assistance grants to be able to help us create a rapid rehousing program for people who are leaving Department of Corrections. And there's current consideration about how to use the Department of Justice related CARES Act funds to be able to scale that program further. So it's just really to say there are many different federal sources of funds that can be used to provide housing needs for all the different needs, whether that's people currently in shelters or on the streets or in hotels, those that are newly falling into homelessness, those that are experiencing housing crisis who are not yet on the verge of homelessness, as well as people leaving institutional settings. And it's really smart, I think, to think about how to fulfill all of those needs and use federal money in a smart way. So with that, I'm going to turn this over to Nichelle Carver, who's with the State of Virginia Department of Housing and Community Development. Thanks so much.
Hi, I'm Nichelle Carver from the Virginia Department of Housing and Community Development. I am the Associate Director of the Homeless and Special Needs Housing Unit, and I wanted to talk to you all today about our plan for how Virginia is going to functionally end homelessness. And when I say that, it's pretty scary to say, because what it means is that we are putting our efforts forward. We're taking our resources, both human and all of the financial resources, and we are going to functionally end homelessness. It's a scary thought, but all of us should have come into this business with the thought that this is what we were planning to do. And so one thing I'll say that you need is you should have cheerleaders in high places. For us, we started out with Governor Northam, who really championed the idea of focusing on our most vulnerable citizens. We also had assistance from our Secretariat, and our Director, Eric Johnston, and our Deputy Director, Pam Kessner, all also saw the vision that we had to focus on our most vulnerable citizens when COVID hit. So back in the early days of March, we started thinking, what are we going to do? Because we recognized that this was a public health crisis. And if we left individuals staying outside, they were at risk for contracting the virus and possibly spreading it. But also, we already know that people who live outside tend to have more health problems. So we saw this as a responsibility, and it was seen from the top level all the way down to my team, who worked tirelessly in the beginning to try to see where the gaps were and what were the needs. So just to give you a little bit about what Virginia looks like in terms of our COCs and local planning groups, we have 15 COCs that are independent, and then we have one balance of state COC that is comprised of 12 local planning groups. So we reached out to all 27 COC and local planning groups throughout these early days to see where are some gaps, what do you see are some problems that are going to come up if you could not help, and how, you know, how are you planning to do this? What are the resources that you're missing? We also noticed that even though everybody was in crisis, our morale was high because we saw what we were doing as important, not just for those first sets of individuals, but we were starting to get the idea that maybe we could turn this into something bigger now that everybody was focused on people experiencing homelessness. I always think about the fact that all of us have been very focused on this group of our vulnerable citizens, and nobody else had been. And all of a sudden, everybody else is. So now that we have the spotlight, let's use it to our advantage. Let's figure out a way to, as I said to the National Alliance in an email, let's take all of these lemons that we've been getting and make the biggest vat of lemonade we can make, because this could be something big. And this is where we started thinking of like, what do we do? So first we thought about, like I said, our most vulnerable population, and said, all right, how much would it cost if we were to house all of the folks who are sleeping outside, the people who are in shelters where they say you got to leave during the day. So the ones where you got to leave at like 7 in the morning, come back at 6, because we saw that there would be a chance for a person to go out, possibly contract COVID-19, bring it back to the shelter. And now we have an outbreak in a shelter because we weren't able to keep people safe for 24 hours a day. And then there were percentages of folks who lived or who were staying in those really large shelters, and it made social distancing almost impossible. So we said, let's take a percentage out of those shelters and let's see if we can have hotel motel vouchers for all of those folks. So we actually pulled the data for how much hotels cost through the different regions, came up with just kind of a median amount, and then pulled the numbers for how many people for our 2020 point in time count. So it was preliminary numbers, but we reached out to each COC to get that information. We also, like I said, talked to everybody and said, we're looking at this as a public health crisis. What do we need to do to, once we get people into the shelters, keep them from going back on the street, because that doesn't benefit anyone. And we keep hearing that there's going to be this second wave. If there's a second wave, do we really want to do this song and dance again at the end of the year? No, we want to be able to get people in their permanent homes so that when shelter in place orders possibly come up again, they're already where they need to be to stay safe. And so we started having those conversations in the very beginning about, let's not think about this as how do we get them safe for the moment. Let's think about this as how we get them safe permanently so that we can then keep them housed. And then we also, we had that formula that we worked on, but we told communities, you got to let us know if this is not enough money to do what you're trying to do. Because we actually, like I said, we had support from the governor's office where they kind of started out saying, we're going to put 2.5 million towards this problem. And so we wanted to make sure that we use that 2.5 million very wisely, again, to initially get folks off of the street, but we also needed to make sure they had food and they had supplies. One of the things we did with food that I think was a non-traditional partnership is we looked at Virginia Main Street, and those are more mom and pop kind of restaurants and everything. And we reached out to them to say, you have restaurants that aren't able to service folks in the same way. We have people who need to eat. Can we form some sort of partnership to make sure that our folks that are in the hotel motels are able to get hot meals delivered to them? And so we formed some of those partnerships in the early days of the pandemic, again, with the thought that we have groups that need to survive this. And how do we get them to survive is we take our resources and we use them very wisely. Oh, good. I said use resources wisely before I saw the slide. Anyway, so we held meetings because we looked at the fact that it takes multiple partners. We had meetings with the Virginia Department of Health, Virginia Housing, which is our state housing finance agency, the Department of Behavioral Health and Developmental Services, the Department of Social Services, our Department of Medical Assistance Services, and that's our Medicaid. But then we also worked with MCOs, and our agency is, we have a housing side, but we also have a community development side. And we looked at what resources are available, because we realized that this can't just be the homeless services system trying to fix this. Again, public service or public health crisis means that it's in everybody's best interest to figure out the solutions. And so we pulled all of these folks around the table, and I will say, along with how our team was working long hours, our director and our deputy were working on the weekend. We had people from the health department working on the weekend. Again, everybody put a lot of time and energy up front, because we recognize by doing that now, we might be able to save lives, and we do less later, or we do things differently later. We also looked at all the different funding sources, because like community development had some CDBG, the MCOs had resources, so some MCOs, and those are managed care organizations, excuse me. But some of them reached out to us and said, we have supplies, we have human resources. So they were able to step in and assist us where we were lacking. Some of our more rural communities depended on older adults to help with volunteering. And so those more elderly residents, it wasn't safe for them to start going into the shelter to continue to volunteer. So you had some shelters with little to no staff and no volunteers. Well, the MCOs had peer support that were able to step right in and assist, because a lot of their clients were shared between the homeless services system. We looked at like rating the different funding sources and saying, all right, one funding source has to be used by June 30th. Another one has to be used by December 31st, 2020. Another has to be used by September 2022. And we started looking at how can we maximize these resources? But also, once we got the people into the shelters, now we can get them housed and kind of look at how we can stretch that funding out to get people in housing and then stabilize them in housing with the different resources. Again, we have some realities that we have to deal with, and I'll talk about that a little bit later. But the biggest thing is we needed to look at it as a big puzzle. And instead of just throwing money at the problem, be very intentional with how we used our resources. So the other thing is you have to believe this goal is achievable. So remember, I paused in the beginning because it does give me some like, we're going to end homelessness. That's just a scary thought. I've been in this field for 22 years, and it's always been that this is what we wanted to do, but it's always been aspirational. And now I can see it as it's actually a real thing. Like, we can do this. But then you got to convince everybody. We got to get everybody on the same message, because if one person or one community doesn't believe that it can be done, then you got to fight against that disbelief. And the people who suffer the most are the folks we're serving. So we had a second round of calls with all of our COCs and local planning groups. We talked about our regular Virginia Homeless Solutions Program funding. And then we asked them this really strange question: what would it take to end homelessness in your community? And some people kind of laughed, you know, like, okay, I got you, Shell. But other people really thought, you're serious? And I was like, yes, we are serious. The state is serious with how can we support the efforts? And so things came up like, we need to get more money. We are checking that off. We have resources from ESG Cares, CARES Relief, CDBG Care, or the CARES Act money. So ESG CV, CDBG CV, HOPWA CV. There's some FEMA funding involved. We have some Housing Trust Fund funding. We have our regular Virginia Homeless Solutions Program funding. So again, we need to just take all these different funding sources and be very thoughtful about how we use it. And we also need to staff up. We were very clear, this should not be taken with the thought that you're going to do it with the same staff, because if you do that, you will burn folks out. You will not accomplish your goal. And so we got, you know, when people said, well, where are we going to find staff? Well, guess what? May 2020, a whole lot of folks graduated college and are looking for jobs. And we have a whole bunch of work that we need to do to try to end homelessness. So match them up and make it happen. And then you have to believe that you can do it, right? If you don't believe it, it's not going to happen. So we asked them to look at what will it take? What will it take to get this done? And be reasonable, but really look at if you were to house all 180 people, because I do want to be clear, our problem is not the same as Los Angeles County. In Virginia, in our point in time count, we had a little under 6,000 folks experiencing homelessness in our 2019 PIT. That's for the entire Commonwealth of Virginia. So I want to acknowledge and recognize our problem is a different problem than some of the major cities in this country. But with that being said, our problem is more solvable now than later, with it being smaller. And I think we have the right resources at the right time to be able to make it happen. So what are our challenges that we need to, is what I had and then crossed it out, because we have to, we will overcome. And the challenges are, we got to keep everybody on message and on task, because the thing is, COVID-19 will blow over. It's going to be devastating at the end of it that we have to clean up all the pieces, but we will be in a post-COVID world, and we still need to keep the same thought that we have to end homelessness, right? This isn't just we're in crisis, let's think of something nice and flowery. It is, we're in a crisis. How do we take this crisis and make it good for everybody in the long run? So we have to stay on message and we have to stay on task. We also have to build a very strong rental and mortgage protection program that's not part of, but works with the homeless services system. They're not the same, right? And if you treat them the same, guess what? Homelessness loses, because there's not enough money in the homeless service system for the rental mortgage protection or the rental mortgage problem that we know is coming down the pike. We know that there is a crisis headed our way in a flood because folks are struggling and not able to pay their rents. Those are important people that we have to address, but those people are most likely not going to become homeless. So let's not take our small homeless money where we know we got folks who are homeless, and let's try to make sure we build a strong rental mortgage protection program, and we work alongside each other and make sure that both pieces are connected, but do not confuse the two. We also have to tackle the lack of affordable housing. We know that there's not enough affordable housing, but here's the thing. Do you keep people homeless because there's not enough affordable housing? Because then that means we failed. What we have to do is figure out ways to bridge the gaps that we know exist. Some of the ways we can do it is PSH. There's lots of PSH in the works. We know mainstream vouchers have increased, and we can use our rapid rehousing for bridge funding, because instead of saying, let me just hold this person homeless until PSH opens up, let's try rapid rehousing, try to build a little bit extra supports with the understanding that we're going to connect to these PSH programs and try to get them into a PSH program. Remember, rapid rehousing is for up to 2 years. Also home sharing. So looking at having almost a roommate situation. If we don't have enough housing, can we start matching up people? And also partnering older adults. And I like to say big mamas because I had a big mama, but like your grandmas or your older adults with parenting youth. Because if you think about it, we used to have a society that had multiple generations in one home. And that's not a bad thing. That's actually good for us to learn from each other. Older adults benefit from having very young children in their lives. This is a way to make our families and our relationships stronger and create those natural supports that a lot of us are used to. And then we also have to strengthen our housing stabilization, because that's one thing that's a little bit of a challenge when you're thinking we're about to house everybody. We need to make sure we have really strong housing stabilization programs. And then we have to work with our partners we don't normally work with. We need to work with the housing production and preservation. And look at places like, if you think about it, with COVID, a lot of us are working from home. I am home. A lot of people might not ever go back to the way things were. So there are going to be office buildings that are empty, and we need to see that as a way to build some housing. Like, we can turn all of these things into housing for folks that need it, but not just housing, affordable housing. If you just create a whole bunch of housing, but nobody can afford it, it's not going to do what we need it to do. So we need to make sure that we're focused on creating affordable housing and using like old schools, office buildings. Just think of projects that are not traditional. And then help everybody understand what functionally ending homelessness means. Because it doesn't mean no one will ever be homeless. It means that you have built a system where if somebody becomes homeless, within 30 days, they can be put into a permanent housing situation. Again, focus on the fact that it's permanent housing. Within 30 days, we can get them back into permanent housing. All right, so this is going to take system transformation, right? It means that we are going to have to move outside of our regular homeless services system and bring some partners around the table that might not see homelessness as their issue, and convince them through your messaging that it is. We also need to work more with community-based organizations, folks that are in those communities working. So I'm talking Black and Latino focused organizations that are out there doing the work with underserved populations that we traditionally have not gave funding to. Because if we're really trying to reach folks, we need to have a racial equity lens on everything we do. We also need to stay away from low-hanging fruit. And everybody knows that this is typically what we do. We focus on what can we do to get a quick win, to score a quick win. When you do that, you have left out the communities that are harder to serve because of racial inequities, because of racism, because of oppression. So once you start talking about low-hanging fruit, you're not talking about the folks that need you the most. So I would like for us to try not to have that in our vocabulary when we're dealing with this. We need to focus on those who are hardest to serve, who have the most barriers in front of them. We already know that racial disparities exist in our homeless services system. We need to tackle that. We need to try to focus on those folks, because if we do, then everybody wins. It doesn't work the other way around. If we figure out low-hanging fruit, we don't magically learn how to deal with the harder to serve. But if we figure out how to help folks who have so many barriers for things that are outside of their control, then it's much easier to help the people with little to no barriers. So the other last part I want to say is we also have to accept that our jobs are different. From this point forward, we're working our way out of a job, or working our way into having our jobs look very different. And that's okay, and it's scary, and you'll be fine. Because remember, if our end goal is to assist people who are in need and they're coming to us, we're not supposed to be helping them just so we can keep a job. We're supposed to be getting them permanently housed. And so with that, I have my information right here. I'm Nichelle Carver. And I know there were some questions, and we'll be answering those questions and have those available for you as well. So thank you for taking your time to listen to me. I appreciate the National Alliance giving me the opportunity to have this forum, and hopefully everybody stays well and safe. Thank you.